typically are bad, which like huge epidemic in the world today is opioids don't really make any difference. And actually there was a good study recently published in I think in JAMA also that showed that actually non-steroidals and Tylenol do better than patients on opioids, their pain control. So,
and that is the next question. This questioner is concerned about her brother who has a morphine pump surgically implanted in his back. How in the world does this work? He says he doesn't feel drugged. I don't believe him.
Yeah, so I don't put any implantable stimulators or pumps in. There are some surgeons that do them, and then there's some pain doctors that do them. There is some efficacy in the literature about them. I think with the morphine pumps, the thoughts are it's not so systemic, the morphine, that it goes right to where the problem is, and maybe you don't, have all the side effects or the other issues.
Okay.
Probably best to discuss with a pain doctor.
Great. Tell us about those at-home anti-gravity devices. Are they safe? Do they work?
Are we talking about inversion tables?
I think they're inversion tables, inversion chairs, or possibly the ankle, the Cirque du Soleil training.
So I'm okay typically when patients ask me about inversion tables. What it theoretically does is stretches your spine out, maybe changes your alignment, maybe takes pressure off the nerves. The problem is once you're off of it, you're back to square one, right? So I don't think they affect the long-term outcome. I have a bad story from hanging from bars and things. I had a really fit young lady, actually, like she did fitness competitions, and she was doing like upside down sit-ups, and she actually fell from one of those and was paralyzed. Yeah. So I have a really bad story about that. I have a lot of bad stories, unfortunately. Yeah. So I don't recommend those typically too much.
Okay, I'm going to ask two more questions, and these are, again, probably related. Number one, when do I know to go to an orthopedist or a back doctor?
Yeah.
When have I reached that point?
So I think, again, the things like a surgeon can help you with is if you have compressed nerves or a spinal cord and you have either radiating pain down your arms or legs, numbness, or neurologic symptoms, which would be manifest as numbness or weakness. And then, of course, those other bad things I mentioned, like tumors, infection, fractures.
And what is the best way to sleep with chronic low back pain? Is there a particular position, pillow between the legs, a particular mattress, hard better, soft better? So
really the key, to when you're not thinking about your spine or what you're doing sort of when you're sleeping is keeping your spine in what we call a neutral alignment. So there are actually normal curvatures to your back and your neck and such. Your low back should be curved kind of in a sway shape called what we call lordosis. And so when you sleep, you just want to maintain normal alignment. Actually, you want to maintain neutral normal alignment all the time, and that helps prevent pain. So it's really dependent upon the individual. There's places you can go to get evaluated, like I think like Relax the Back and other stores and things. They actually have people in there that are pretty educated to look at you and try to help you make decisions about what kind of mattress and things like that. Neutral is important.
I'm going to ask one more question. Sure. Because I'm looking at this audience and I feel it's necessary. Of the daily things we do, going to Sam's or Costco, lugging the water, golf swings, we joked about it, but all seriousness and just the swing of a golf club. What particular biomechanical movements should we, particularly as we age, really be careful about? The body seems to move in certain ways that we want it to move differently. So arms above the head when you're working out with weights, twisting motions. How do we prepare for them? We can't always avoid them, but of those we can, what should we avoid?
Yeah, I think the thing to avoid, and I think the sort of history that most patients kind of relay when they had a back injury, especially their low back, is typically bending or flexing their lumbar spine. So what happens then is you put a lot of pressure on the disc, like I mentioned. you put a lot of strain. You're not in a good biomechanical advantage when you go to pick something heavy up with your back flexed like this. So, again, maintaining a good alignment, having a strong core, and if you're going to pick something heavy, it's kind of, I'm sure you've all heard this, use your legs, right? So your quadriceps and your hamstrings and such and your glutes are the biggest muscle groups in your body. So if you're going to lift something, you want to use those. So use your legs, like bend, keep your back neutral, and then lift.
Thank you so much. Really appreciate it. We learned so much today in such a short period of time about how to keep our backs healthy and advances in spine surgery, preventing injury. You've clearly got our backs, so thank you for sharing this. I'd also like to thank Dr. Jay Kaufman, who has been sitting here diligently answering those questions that we did not get a chance to address online. And certainly a huge thank you goes to our kind and general hosts here at Mercedes-Benz Sugarland, and ABC13.com and ABC13 for giving us a platform to supply our Houston community with knowledge and awareness regarding our health. And I'd also like to extend our gratitude to UT physicians, of which two of these gentlemen are of a part, and these are our partners in health at UTHealth. There are clinical faculty from the McGovern Medical School who teach, train, treat, and provide the highest quality care for your entire family. And some of our UT physicians and staff are here with us tonight to provide more information on our clinics and services, such as the Bone Health Clinic. I was glad you mentioned that. So please stop by and see them or visit UTphysicians.com. Tonight was the fourth of 7 UTHealth house calls. Our next one will cover nutrition on Thursday, September 20th, again this month, at Mercedes-Benz of West Houston. For more information about UTHealth house calls, please visit Health Check section on ABC13.com. This presentation you will be able to see on your own computers if you go to the Health Check section on ABC13.com, and it will be up for several days. Thank you again, and we hope to see you next time.